Yeah.
I went to Quinsigamond Community College. I graduated in December of 2009. When you come into the program, it's 6 months long.
Yes.
And so you're able to go to 3 different areas if you so choose. The first area you go to for 6 weeks, and they tell you, like I went to an area called South 6. It's on the Memorial campus, and you know that you're going to at least make one switch from Memorial and University. You're going to either start on University and then go to Memorial, and then maybe come back to University, or the other way around. But you will have 6 months on each campus, and then that third portion you kind of had some input on. So say if I started at South 6, which is a general medicine floor on Memorial, and then my second 6 weeks I came to 4 West on University, which I did not have any input in, but I came to University. That's a trauma surgical floor, or orthopedic surgical floor. So I did my second 6 weeks on 4 West, and then the third 6 weeks they'll say, okay, do you have any special interests? What do you think you might kind of want to do? And at that time I had worked in the PACU. I really enjoyed my time on 4 West, so I was thinking all surgical, as opposed to medicine, because medicine was really scary for me, because those people are really sick and they're gross and they're just leaky. You know, I mean, they're hard patients. Now I love medicine. Yeah. I love it. Yeah. I'm getting ready to go to a medical ICU, and I can't wait.
Awesome.
It's going to be great. So my third 6 weeks, I stayed on 4 West. So I did my last 12 weeks on the orthopedic surgical floor. And then you're not guaranteed a job either. So you come into the program, they tell you, we're not going to guarantee you a job, we don't give you benefits, we pay you, I made $29.50 an hour, but you don't have benefits and you're not guaranteed a job. But everybody who's been in the program ends up getting placed. So kind of take that as you may. So the last week that we were in the program, nobody had jobs, and they tell you to go and talk to unit managers and kind of put your name out there. So I talked to the manager of the float pool, and she actually hired 2 of us. And so I started on evenings. It was like the last day in the program, she was able to get 2 positions cleared in the hospital and came and gave us the offer, and we signed that day. And I started on evenings. I did evenings for about 6 months, and then got a job on days in the float pool. And like I said, now I'm going to be starting. I'm making a transfer to the ICU. So. I don't know. I mean, it's hard to say, because if I didn't have the challenges, I mean, there were challenges, like being with multiple preceptors, and some days you come in and they don't have anybody assigned to you, and they just kind of toss you like, oh, okay, well, today Sally's going to be your preceptor, and so you go with Sally, and Sally didn't even know she was going to be precepting you, so she's obviously, maybe that day you have somebody who has a transactional style, because they're just, they're thrown off because now they have an orientee. All of those things help. All of those things help you grow. And so I think, no, I wouldn't have changed anything. I think that if somebody is going to be in a program like that, or not be in a program like that, when you are new and you come out into the field, you've just got to be flexible. You have to be ready for spontaneity. You have to trust what you know and know what you don't know. And so you just roll with it, and you just learn and try to grow every day. As far as from a policy standpoint, or the way it was structured, no, I think it was great. I wouldn't change anything. I think it was awesome.
Okay, so you felt...
Maybe it wouldn't have benefited me if I would have had the same preceptor every day.
Okay.
I can't really say how that would have been. It probably would have been awesome in a different way.
All right, so in your opinion, you felt that having different preceptors enhanced your ability to learn your nursing role?
Absolutely. But maybe for somebody else, they wouldn't tell you that.
Okay.
But for me, did I enjoy it all the time? No, I didn't enjoy it. But I think that you don't have to enjoy something for that to benefit you. Sometimes the most challenging things, probably most of the time, the most challenging things, even unpleasantly challenging, are where you learn the most. If you can be present and attentive in those situations, you're never going to forget an unpleasant situation. You're always going to remember that. And hopefully you bring something from that, and then you take that every day that you come into work. So, no, I think it was great.
Good. Now, would you recommend UMASS's program to other new grad nurses to apply to?
Absolutely.
Okay.
Yeah, I would just say that if you're going to do it, just come and give it your all, and know that you're gonna have a multitude of examples displayed to you every day. Some of which you would say, I would never take that into my practice and never display that in my or reflect that in my practice. Some things or some people you're going to work with, you're going to just admire so much, and you say, I want to be just like them. So yeah, I would definitely highly recommend. You know, they're kind of like it's like Yoda and Luke Skywalker kind of.
Okay.
You just trust in them implicitly to give you every piece of advice they give you that it's, you know, you almost look at them as like being just absolute experts in this field. And
Right.
because we're novices, we trust them completely. I have both.
Okay.
I have both, but obviously the individuals who influence me the most and who I really carry, you know, their teaching and their vision every day that I come. Obviously, transformational leaders.
Right. Now, do you think you respond better to a transformational type leader or a transactional type leader?
Oh, absolutely, transformational.
Yes.
You believe in what their vision is. So you want to work with them. You want to work by them, by their side. You want to work for them because it feels good. You're not just doing something because they're telling you to do it. If I set up a program, ideally set up a program,
yes.
I would probably have somebody go through the same, like I would choose the most awesome nurse. Hopefully I would have a system down of being able to really assess as much as I could the strengths and weaknesses, personality traits of this new orientee by maybe some kind of interview process or personality test. You go out to lunch with them or something, I don't know, go play Frisbee with them or something and say, okay, so I have this pool of preceptors here. I'm going to put Janet with Margaret because I just think that I think Margaret is really fit for Janet, you know, and have Janet really be with this awesome Margaret for the whole time. That's the way I would do it because I could see how the way it was set up, if you're not flexible, if you're not prone to grow in a spontaneous environment, if you have thin skin, if you're really easily deflated, I could see how somebody could really kind of slip between the cracks. And if you didn't have that intestinal fortitude, you know, maybe it would appear possibly that it's not run professionally, or maybe on UMASS's side they don't really care, or they don't really have their act together because here I am coming into Orient and nobody even knows that they're going to orient me, and now I'm just going with Sally. And why am I going with Sally? She doesn't even know she's orienting me. And not really able to say, okay, well, it is what it is. We're going to grind it out and we're going to make it happen today. It takes a special kind of person. Not that I'm special. Yeah, I am kind of special, but it takes a certain kind of individual to be able to thrive in that environment. So I would definitely have the same precept.
Perfect. All right, Jason, it was awesome talking to you. I really appreciate you taking the time to kind of talk about your preceptorship and how you felt about it and how it's made you into the amazing nurse that you are today.
Well, just come and try to help people every day.
Right? Saving the world.
That's it, man.
One life at a time.
One patient at a time.
One patient at a time.
Thanks, Seneca.
All right.
Thanks.